Hello and welcome back, and as promised, today we are looking at the male reproductive system. So most people know their own body parts quite well, and I would like to think that you do. So as I said yesterday, I think it's important that a male understands the female body and the workings of the female body, and similarly the female understands the anatomy of a male. Due to pure understanding, also having a child, understanding certain medical issues that may arise from that, I think it's just important that we understand each other's bodies. So we're looking today at the male reproductive system, and in some respects, the male system, even though it looks a bit more complex here, can be a little bit more simpler. And I suppose a lot of that is because the genitalia is outside of the body, whereas women is tucked up, so it's a little bit harder to see. So obviously we'll start with what everybody does know and understand is obviously we've got the penis, which is the reproductive organ, and we've got the testes. Now, yes, we've heard a whole host of names being called, but the testis is one and testes two is where the sperm is produced. They are housed in the scrotum, which is a sac of skin around the testes, and the scrotum actually does have an important job, and it is to keep the scrotum at the right temperature, and the right temperature is important for the production of sperm. So it has been known, I suppose, and promoted a bit more recently that particularly say at night time that boys should wear things like boxer shorts to allow air to circulate and for the testes to keep cool. So their body temperature is usually close to our normal body temperature, but often are a little bit cooler. And you will have noticed that often in hot temperatures, the scrotum and the testes move further, or the testes inside the scrotum move further away from the body, and in colder temperatures they move closer to the body for the body warmth. So that's one way of the body regulating that temperature for the optimum temperature for the sperm production. So unlike women that are born with their certain amount of eggs that they have for life and then they deteriorate, in men they are constantly regenerating. So you're not born with an allotment of sperm, they're constantly being regenerated, which is why men can often reproduce and produce children for longer periods of time. There has been some debate about the risk of autism being higher in older parents, but certainly I haven't seen any say I'm not right, but haven't seen anything yet with birth defects, and that due to the egg, or like the egg mutating and so forth. So with men, their penises, they're born with a foreskin in some families, and in some cultures that is removed. Certainly it was very common in the 70s and the 80s for that to occur, and is less common now. So it's actually more common now for boys and men to keep their foreskin. Some families do that, do remove it so that they look like their father if their father is of a generation that did have it removed. Others don't worry. And while it's still done, a lot of people are choosing not to do it because there's no need, provided you use, good personal hygiene, there's no need for it to be removed, and that myth has been kind of debunked, and many urologists and specialists in the field recommend not doing it. But again, it comes down to sometimes cultural preferences, and it also comes down to family preferences. So that one I'm not entering into. So we then have what's called the glands. Now the glands, otherwise known as the head of the penis, you can see here our urethra runs through the center. And as I stated in the girls video, that is where semen comes out of, as well as urine. So it has two functions, whereas women have two separate parts of the body for that function. So around in the penis is the erectile tissue. So what happens is blood rushes to that area and engorges the area, and therefore that's when men will get an erection there. Similar to women, they have a bladder, and the urethra, the ureter, that's an incorrect labeled diagram there, is what takes the urine from the bladder down to the urethra for removal from the body. You'll notice men too have a pubic bone that you can see just here. But interestingly, looking at more of, so we can see that the bladder and all of that is similar. You can see here, we've got this tube that comes, here we have our testis, here we have our epididymis. Our epididymis is a coil, I suppose, very tightly coiled tubes. So the testis kind of produces the sperm. It kind of moves into this area, I suppose, there it matures. But then at time of ejaculation, the sperm can travel, or in preparation for, the sperm travels along this tube here called the vas deferens. So the vas deferens is the tube where that sperm travels along. So sperm is very different to semen. Sperm is just the gametes that house the genetic information. It travels along here, and you can see here we have what's called a seminal vesicle. So it then adds the fluid to the sperm that's traveling, and that's then making your semen. Now, very recently, we've been hearing a lot about prostate cancer in men. Well, it's not in women because we don't have one, but prostate cancer here, and that's a gland that sits then underneath the bladder, and also is involved in erectile function there, and so it also has a role. So when we talk about having a vasectomy, that's the cutting of the vas deferens. So still produce sperm down here, but there's not a path for them to go through. Semen is still produced, so it is fluid from the seminal vesicle is still being produced and enters that gland for removal from the body, but it's not with sperm in it. So that, provided you do the test afterwards, it reduces the sperm from the semen, and then it reduces the risk of pregnancy. So there's a few other parts that you can see there, but none of those are really what we're needing to look at. Now, as by all means research if you wish, like yesterday's lesson, we're going to copy down a table with all those parts and functions, and I'm going to get you again to do a Microsoft Forms just to check in and see how we're going with that. So if you have a look here, and I'll just move me out of the way, you can see here the penis is the male sex organ, testes produces the sperm, the epididymis stores the sperm duct or the vas deferens is where the sperm travels through, the seminal vesicle adds fluid to that sperm, the scrotum holds the testes, and the urethra is where the semen is expelled. So what I'd like you to do is copy that down into your books, complete the Microsoft Forms just so that I can see how you're tracking, and also just checking that you are engaging in our home learning. That'll be enough for today. We'll move on to some other things tomorrow. See you then.